Well, we just finished up doing the trigger point therapy on the upper back, and now we're going to go into, and we're going to show you how I like to work clients that have asthma, chronic bronchitis. This technique can be done on children, adults, and the elderly. It's very effective. You would only do it if they have asthma pre or post asthma attack. You never want to do this when they're actually in an asthma attack itself. So I can't reiterate that enough. Do not do this when they're in active asthma attack. Okay, he's nice and oiled up. All right, we are going to come in, and we have not showed you this before, but this is our oval cup. And this cup is amazing for an adult. It fits right between the intercostals, between the ribs. It's very effective. It's strong enough to do the job. But if this client is extremely sore and tender, you want to go to something a little bit softer, and that would be, for children especially, you would use the smallest one of the silicone cups that have a handle. This can't be done with the domed cups because they're too large, and you need that handle to make sure you're lifting as you move the cup. All right, so the client is all nice and lubricated. If the client is only coming in to have an asthma treatment done, I usually start off and leave the cover up, and I will put a hydroculator pack on the back and just let it sit there for a while, warming up the tissue, because that tissue is usually very tight and very sensitive. Once that tissue is warmed up, I can begin working. So we're going to use actually our oval cup on Igor, and if they're coming in only for an asthma treatment, you want to make sure that you are warming up the area that you're going to treat, because people that have chronic asthma, it's usually very tight. They're very sore. You want to get all the way out to the lateral side of the body. And once again, these glass cups tend to be a little bit colder. So you want to make sure that you warmed it in your hand, especially if you've had a hot pack on that client. So you really want to do a nice job of pre-treating that area before you even begin to work on it. Cups comes to the side. The other cup that you could possibly use are the polycarbonates, size appropriate for your client. But what works for me, best for me, is the oval. I'm not having to worry about the tubing draping over my client. So the first thing you want to do, I like to work opposite sides so I can allow my body to move back and forth, and I don't need to use any muscle strength whatsoever. I'm going to find my first opening. Make sure the cup is warm, place it down, and now you want to instruct your client, take a nice deep breath, and as they exhale, come back in. Move it down. Inhale, nice deep as you can. Follow the rib. Inhale, exhale, come in. Move it up. Nice deep breath. And back in. So you're going to follow this all the way down till you run out of the ribs, down to T12. You can go back and forth, and you can repeat this several times. Usually it takes 3 to 5 passes doing it this way. Now we're going to do it the opposite way. Go ahead and take a nice deep breath. Let it go. Take it out. And now he's going to inhale. And we're going to move it down and do the same thing, back and forth until you reach T12. Once that is done and you're happy, you can go back and like I said, this can be repeated 3 to 5 times. And this is great for people that have asthma, that they have become extremely tight in their rib cages. A lot of children get that barrel chest. And they definitely need to have that done so that they can actually get full breaths when they do have an asthma attack. if a client comes in and they have a lot of chest congestion, the best thing that you can do is flash cupping on those clients. When you do flash cupping on your clients that have chest congestion, you want to make sure that you use a cup that's a little bit larger. I'm going to take my magnet out of there, place that on the client, and this is very quick. Come in, release. Tight as you can, release. And what you're doing is by doing this really quickly, you're creating a vibration within the lugs, and it helps to expel any type of congestion that they have. And it's a little bit more than flash cupping that you do at the beginning because it's a lot deeper. If you notice, I've got about 3 pumps that I'm using, a little bit less here on the side. And some people, when they do it, I never recommend pulling a cup off, but some people like to lift it up and it creates a little bit more vibration. So if the client's not really sore, this is really nice to help that congestion leave the body. When you're all done with that, I usually end by creating some more vibration inside the lung itself by cupping your hand. So you hear that nice popping sound? What I'm doing is creating a vibration inside my hand. It's going down inside the client's lungs. It's a procedure that they do on a lot of people that have cystic fibrosis. And you can get as creative as you need to. But it's a great way to get that congestion broken up and get it out of the lungs. If they're extremely congested, you can also place the cups static on the back between the end of the shoulders and T12 and leave the cups, your polycarbonates on static for around 5 minutes and then take them off. Those are all different options that you can do. You choose the one that best fits your client's needs at the time that they come in, but it's a great way to get more clients into your practice. If you're doing it for one of your clients come in and they've had asthma, most of the time their kids have asthma, they bring the children in, they tell their neighbors, they bring their children in. Next thing you know is you've tripled your practice by making it almost a family practice.